Bridges are what we term for false teeth that are actually fixed into the mouth. And so if your tooth hasn't got a filling in it, and the best way is actually just to glue a tooth onto an adjacent sound tooth, and these have been done for many years and are extremely successful. However, they have limitations. What we can do is we can make a crown off a single tooth, and then that supports the single false tooth, and these have been very successful as well, especially if the supporting tooth has already had some restoration since discoloured. And going on again, we can actually use the teeth either side, and this is obviously a lot more rigid. However, often when a tooth's crowned, the nerve of the tooth dies and the tooth becomes more brittle and the crown can break off, and sometimes these crowns have to be supported by pins, but these pins also can break, and so you're with less and less tooth tissue, and you can make a bridge off a few pins, but these are the least successful, probably the more expensive and least likely to work. And so in this instance the bridge is made out of plastic, but it has lasted about 8 years and is not as expensive as an implant retained bridge, but more expensive than a denture.